current telephony technology doesn't allow us to kind of track wait time and so on our phones. It's certainly something we would be looking at as part of our service modernization agenda. But at this time, we can't track that at the individual call level. We certainly do client satisfaction tracking in terms of looking at the overall service experience our clients are getting and monitoring that on an office-by-office basis. Yeah.
And do you actually put that, the office-by-office into a report once a year?
Excuse me?
Do you actually do the office-by-office tracking? Does that go into a kind of annual report once a year?
Thank you. I'm sorry. That's your time. So the Minister has now 30 minutes for the right of reply. If she does not use all of her 30 minutes, the extra minutes will be then left back for the three parties to be split between equally. So please go ahead.
Well, thank you very much, Madam Chair. And because we've had so many thoughtful and in-depth questions to date during this Estimates Committee, I want to assure the members that we intend to catch up with all the responses, including the most recent by Ms. Forster. Just by way of introduction, I would like to say that since I was appointed the Minister 4 months ago, I have made every attempt to understand this ministry with its complexities. As we've heard from the questions, there are a lot of very precise details involved. Sure, they need to be pursued, and we need to be assured in every case that, first of all, we're helping vulnerable people to the extent possible, and that we're doing it in a fiscally responsible way in terms of their eligibility and that sort of thing. I've been most impressed by the frontline workers. I've had the opportunity to visit, as I mentioned this morning, OW, ODSP, women's shelters, employment agencies, community living agencies, as well as unveiling the plaques at both Huronia and Southwest Regional Centre known as Cedar Springs. And at all times, I really have been incredibly impressed by the dedication of the workers, especially in the developmental disabilities sector. When you ask about how long have you worked in this group home, you get responses like 15 years, and that seems to be the norm. And I really want to emphasize that because with the deinstitutionalization, I think there were fears on the parts of relatives and maybe the system as a whole. Would we be able to appropriately house those individuals? And everything that I've seen has really reinforced that we have transformed the developmental disability sector in particular. But we obviously have a lot more work to do. And I'm going to go back to the questions that were posed this morning, because there was a lot of interest in the new SAMS, the new computer system that's going to go live November 11th. And we had an overview from ADM Richard Steele a little bit as to what has gone into the training of staff and preparation for this handover. But the man on the ground who has been leading this over the last few years is ADM Martin Toom. So I'd really like you to hear from him in terms of this transition to the new computer system.
Thank you, Minister. So I should say that this is an extremely exciting time for myself and my team. We are deploying this new technology over the next couple of weeks. In terms of a bit of context first, the legacy system, the service delivery model technology, is an antiquated system. It is 14 years old. It was custom built, and it's highly dependent upon notes. So what that means is that caseworkers have to enter a lot of open text throughout the case management system to record what and why they're doing what they're doing in terms of their case management with clients. The Social Assistance Management System, or SAMS, is a modern commercial off-the-shelf application, and it's based on Curum. And Curium, for those of you who aren't aware, it's the world leader now in human services applications. It's used across the world in many jurisdictions, south of the border in Australia, New Zealand, and Europe, for human services applications, including a lot of income support programs as we're using it here. It is data rich, it is highly automated, and that really means that caseworkers don't use notes. They don't put in notes, they put in data. And that forces a lot more consistency in terms of the application and the calculation of benefits for all of the programs. So that definitely enhances program integrity. This new system is also a lot more adaptable to change. So the old system, the SDMT, just as an example, when this government went to put in their first rate increase in 2003, unfortunately that took 9 months to promote in the legacy system, SDMT. That shouldn't have been the case. That was the case. It was a custom-coded system. That change in SAMS today would be an administrative table change that could literally be done overnight. We would have to test that, so it would take longer, but the change itself is that simple. This is most importantly going to lead to a lot of improvements in customer service. The minister's already talked about the client portal, so that's going to give our clients 24/7 access to their case information. It's going to allow them to report income online. It's going to allow them to make changes to their circumstances, and it's also going to allow them to figure out what's going on with their case, to get information, and to receive correspondence online. So I can't understate what a huge fundamental difference it is between the two systems. So it is a major transformation for staff. We can't deny that. There are 11,000 staff across the province, and what we see is a wide spectrum in terms of the comfort that they have to adopting this new technology. Some definitely struggle, there's no doubt about that, and we're there to support them as much as we can. And then there's others that adopt it quite readily. In terms of what we're doing to support staff, first of all, there were 40 hours of end-user training at a minimum over a 10-week period leading up to the early summer. So that took people right through the application end-to-end and all of its functionality. Into the summer and up until very recently, there's been refresher training, up to 20 hours of refresher training for all staff, and that's really focused on those areas of the application that are used more commonly and those that staff actually expressed more of a difficulty with after end-user training. We also have actually been able to put the application itself in all of the offices across the province. So for the past 3 months, the application has been available for staff to go into and actually use the application, try out different tests on it, and management has generally had ways of making time available for staff to go in and spend a few hours every week in that environment. In ODSP, we've increased the staffing complement by 47 to help with the workload over this transition phase. And in Ontario Works, similarly, we provided additional administrative funding to all of our delivery partners so that they can also ease the burden on their staff as they go through this transition. I think the most important kind of illustration that I have, or the most successful initiative that we've had in terms of developing staff in SAMS is we've been able to actually cycle through over 700 caseworkers in our testing centers. So we have a testing center in Toronto, we had one in Sault Ste. Marie and one in Hamilton. So caseworkers actually support us in application testing, in validating data conversion, and in user acceptance testing. And what we've seen consistently is that once staff are in that training center for a week and they've actually been hands-on with the application for a week, they get it. They get to that point where they understand, okay, now I understand why I don't have notes, and I understand how to navigate around the system, and I understand why it's got so much data that's used to calculate those outcomes. And those are really the people that I call converted, and often they help to relieve a lot of the anxiety of their colleagues when they go back to their home offices. In terms of staff engagement, because I know that that was another one of the comments and questions, that's really been a cornerstone of this project. We've had extensive staff engagement over the past 4 years. Staff have been engaged right from the actual design of the applications, validating the business requirements, and right throughout the build. We've surveyed staff twice, so across the province we've surveyed our ODSP workers and also provided those surveying tools to our Ontario Works delivery agents, and the results that we've gotten back from staff have actually resulted in some adjustments that we've made to the training and the refresher. I've personally been out across the province 3 or 4 times right around the province over the past 3 years, and I've engaged with over 300 staff. And while I do have an opportunity to meet with senior managers and managers and supervisors in our delivery agents, it's really the staff that I value the most, meeting them, talking to them, and getting their perspective. And I will say, the one thing that I always tell them is do not pull any punches, and they don't. They tell me what they think, so they certainly do have the opportunity to tell us. And we hear some brutal realities, of course, because of that spectrum. People that do have a lot of anxiety and are struggling with the learning. I will say that I tell them that they don't need to know everything on day one, and I think that's really important, and we really reinforce that with our delivery partners and with staff when we talk to them. There's going to be a lot of tools and supports for them, and it's actually those engagements with staff that help us to develop those tools and supports. So we listen to what they tell us, what would they like. We've developed job aids, we've developed placemats that they can put on their desk where they're going to get a good illustration of how SAMS works and what are the common areas of functionality that they need to know from day one. Ultimately, this is going to be easier for staff. We know that when people get that comfort and familiarity, it is easier for them to use. It is highly automated. It's more consistent. There's also a lot of streamlined business processes. And one example is today, when SDMT, the legacy system, sends a letter, and there's a lot of correspondence to over 600,000 cases, a duplicate letter is actually created on paper and delivered in boxes to the local offices, and those staff actually have to file those duplicate letters back into the master files for those cases. SAMS will just produce those electronically. Those will be linked to the case. Those will never be printed. That's just an example of the kind of business streamlining that this presents. And then, of course, there's also the portal. We're not going to be implementing the portal until early in 2015 so that our caseworkers can just get used to the system before they start getting calls from clients that are using the portal. But once we get that uptake, that's also going to make it easier for staff because a lot more of their clients will be finding out information online, they'll be reporting income, and they'll be changing circumstances themselves. The other point I want to make is that these efficiencies are not intended to reduce the number of staff. What it will do is it'll give staff more time to spend face-to-face with their clients and really working towards real outcomes rather than just doing casework. And I guess the last point that I'd like to make is just on the deployment itself. So obviously this is an extremely complex and very broad implementation. There's 250 offices across the province. We are confident that we're certainly never going to be more confident than we are now in terms of our readiness for this implementation. There have literally been thousands of person days of testing, system testing, application testing, testing the performance of the system, user acceptance testing. There's a couple of tests that I'd just like to highlight just to make the point in terms of our confidence. We've actually done 7 full data conversions. So that means taking all of the data from legacy and converting it into SAMS and running tests and validations of that. That obviously gets better every time, but the last few tests have actually surpassed the metrics that we'd set in terms of the accuracy of data conversion that we needed to hit. We've also run, with each one of those data conversions, we've run a parallel pay run. So we run 600,000 plus payments out of SDMT and then the same number of payments out of SAMS with that converted data, and actually do a match of all of those payments. And that's improved every time. And with the last parallel pay run, that is the one that we're going live with, we are down to under 1% of those payments there's actually a variance, and that's all being managed with our delivery agents in terms of them receiving that information and knowing that they've got to go into those cases and take some action before the first pay run. The other thing is that we have retained the capacity that we have in terms of the development and implementation of this project for several months post-implementation. So we have the full project team, we have all of our vendor partners, and particularly IBM. We've retained the full IBM development capacity for post-implementation so that we know that we can be highly responsive to issues as they come up, particularly those that might have an impact on clients' entitlements.
Well, thank you very much, and I hope that members of the committee will find that reassuring as we go live with SAMS November 11th. There were additional questions related to the 2010 Auditor General's reports as it related to FRO, our favorite subject, specifically staffing issues and so on. And we did point out that in the review in 2012 that the Auditor General did, it was noted that there were significant improvements. But I thought it might be worthwhile to just elaborate a little bit further than we actually did this morning in terms of what has happened since 2010, so people have a fairly clear picture of the progress we've made from a call center model to this client-centered responsive model that we have put in place. So you get a picture of what we're trying to do. We are trying our best to improve the system. So I'd like the Deputy to just give us a bit of an overview of what's happened over the last 4 years.
Thank you very much, Minister. And a significant part of our work in the Family Responsibility Office has been to the extent possible utilize the resources that we do have available to us to core services and core activities. And some of the modernization initiatives that we undertook, we spoke to earlier today. However, a few that I do want to reference, and again, these are initiatives to move activities out that could be done by others more effectively and more efficiently that we can do ourselves, as well as allow the resources that were formerly occupied to that activity to be used for registration of cases, financial adjustments, and enforcement. One that we undertook, and I referenced it this morning, was the transfer of our activities around simply processing documents, both incoming documents and outgoing documents. Incoming documents require the program to obviously take them in, to digitize them, scan them, index them so that they can be attached to the cases, and so that our case workers can use that documentation in either responding to clients or making decisions around cases. And we moved that activity over to a specialized Center of Excellence in the Ministry of Finance, the Oshawa operation that is responsible for processing tax payments as well as any provincially related tax forms. And we get about 500,000 documents annually. We used to, prior to November 2011, have technology that was probably, if you have a home office, you probably have better technology than we had. Scanners, very rudimentary scanners, and almost 20 people simply involved in doing this work, because obviously these documents are very important to get onto a case and to attach to the correct case. The Ministry of Finance does that in a highly automated way. It used to take us, on average, 30 days to process this incoming correspondence end to end. The Ministry of Finance does it for us within 48 hours with almost 100% accuracy. That's a service expectation that we have of them. And we were able, as I said, there were almost 20 staff that were involved in this activity. We do provide the Ministry of Finance with an operating subsidy because it costs them money to do this work, but we were able to retain the staff or the positions within the organization, and we redirected those resources to additional enforcement, but also to the establishment of a client outreach unit. We had piloted an outreach to new clients in the early 2000s on a temporary basis and weren't able to continue it. With these resources, we were able to establish this unit again in late 2011. When a case comes to us for registration, there is, if the address information is unclear, or that kind of information is unclear, we perform a trace and locate to attempt to confirm the location, in particular the payer, and we make an outreach call to both the recipient and the payer to introduce the program to them, to clarify the obligations that both parties have to the Family Responsibility Office. In the case of the payer, it's his obligations or her obligations under the court order, and we articulate the consequences that could occur if those obligations aren't fulfilled. And on the side of the recipient, to provide us with timely information about his or her own location, as well as information that might be helpful to locate the payer. If we can't make that contact. We have confirmed income source information through those calls, the payer actually volunteering where he or she is working so that we can attach wages at source. And since the establishment of that unit, we have contacted over 23,000 clients, new clients, and it is a way to start them out in the program in a fashion that hopefully encourages compliance. Financial adjustments of cases is a very important feature of our work. We conduct over 60,000 such adjustments a year, and these are adjustments due to varied court orders, and some of these are very complex. They can go back retroactively over months or even years, and they really do establish, on the one hand, what the recipient fairly should get under that court order, but on the other hand, what the payer should very fairly be paying. And again, we used to average about 30 days, if not more, to take in these adjustment requests or requirements and to actually do the work. We're completing them within 10 days, 80% of the time, and within 30 days, 99% of the time, because there are occasions when the adjustments are unclear due to ambiguity in the court order. So those are a couple of the areas that, again, we want to make the organization and have tried to make the organization more responsive than it has been in future or in the past. We do make an effort to measure ourselves against other jurisdictions, other similar organizations. And the comparisons are very difficult to make. And as I mentioned this morning, in Canada we are the largest jurisdiction. We have the largest caseload by far. Quebec is second, British Columbia third. We are so comparing us to the majority of Canadian jurisdictions is really difficult. It is around scale. If you have 15,000 or 10,000 cases to manage, it is less complex, and it is a different kind of environment to work within than 180,000 cases. But we do try to measure ourselves against Canadian jurisdictions that are at least a little bit larger than completely small. We classify those as provinces that have caseloads of over 20,000, and we also measure ourselves on a North American-wide basis. The measure that we use are jurisdictions with caseloads of over 135,000 cases, and there are, but we have 180,000 primarily in the United States. And again, the order of magnitude of the efforts required to enforce cases and manage cases is a little bit more comparable when you look at that kind of threshold. Among those jurisdictions, those over 135,000 cases across North America, we outrank all jurisdictions in collection of dollars per full-time equivalent staff member. Our staff, these are not just our enforcement officers. The measure that we use is all staff within our organization comparably, because that's the comparator that is available through the United States Office of Child Support Enforcement. But we collect more than any other jurisdiction of that size. It's about $1.48 million per FTE, and we collect more support per program expenditure dollar than any other jurisdiction of that level. It's about $12 per dollar spent. And it's a similar comparator across Canada among jurisdictions that have over 20,000 cases, and there's only 4 that do, ourselves, Quebec, Alberta, and British Columbia. All other provinces are smaller in order of magnitude. So that's not to say that we rest on those comparisons. $2.1 billion is a significant amount of arrears. It is in the context of $12.5 billion collected since the program's inception. But we are comparable or better than other jurisdictions in many respects. The arrears per case, which is another measure that can be used when you look at the 3 jurisdictions in Canada that do not write off arrears, that's ourselves, British Columbia and Alberta, of that order of magnitude above 20,000 cases. Quebec writes off cases or it writes off arrears. If they do not receive a payment on a case that has ongoing obligations and arrears within a 2-year period, do not receive a payment, they will remove those arrears from their count. If there are no payments and no obligation and no arrears, they'll write off after 1 year. If there are payments made on the case subsequently, they'll put their arrears back on. But they have a variety of ways, and they have the latitude to write off arrears. We do not. Regardless of, even if the payer is deceased, we do not write off those arrears because there is always the potential for us to pursue collection of arrears from the estate of a deceased individual. But on that basis, our arrears per case are roughly 11,600 or 700. That's a little bit lower than Alberta and lower than British Columbia. Alberta, and this is using, we did this comparison using the figures that were published by the CBC. Alberta's is 11,000, almost 11,900 per case, and British Columbia is 12,300. And in both those cases, it does cost more for those programs to collect every dollar. We continue to look at ways to make the program more effective. We are looking at other jurisdictions, primarily in North America, and looking at the way that they actually approach different types of case profiles, cases that are in arrears at an early stage, cases that are very, very hard to collect on. And we're looking at best practices in other jurisdictions, as well as using the analytical capabilities that we have in the Ministry of Community and Social Services to look at whether we can...
Minutes left.
Thank you. To look at whether we can segment our caseload in a way that's more effective, whether we can employ strategies that are more effective depending on the different profiles of the cases. It's always hard to figure out what works and what doesn't work, because oftentimes we employ multiple and simultaneous approaches to enforcement. But we are looking at any avenue that we can to improve the organization. That being said, enforcement is a challenging exercise because we are balancing competing competing considerations. Our responsibilities to the recipients because of the court orders that they have, but also the legitimate ability of payers under the circumstances that they find themselves in at times to be able to pay their obligations. And we're compelled to ultimately enforce the terms of the court orders that we have until such time as they're varied. But by the same token, we do not want to take a punitive approach to enforcement, to punish payers rather than finding ways to encourage them to provide what they are able to pay as opposed to what they have no possibility of being able to pay. We can only do that on a temporary basis with the discretion that we have, but it does form some of the challenge that we face in this program.
You done? Okay.
Yes.
Get to it. Thank you. We'll move on to the official opposition. Mr. Harris.
Thank you for that. I guess, that approach, although difficult, may be part of the problem in why there are so many arrears that, deadbeat dads are simply taking advantage of you for perhaps that approach. My question is, in the AG's follow-up report in 2012, they found that the total amount of support payments in arrears as of December 31st, 2009 was $1.6 billion. I believe we talked about it being $2.1. That was an actual increase of 23% from 2003. Now, they had minimal information, they said your office had minimal information on the balance and could not provide them with the individual balances that accumulated to that total or which portion of this balance was deemed uncollectible. I'm wondering if you could provide to the committee the 2.1. You talk about being cumulative, but is there a breakdown that you could provide to the committee of that to actually reflect that?
Yes, I can. Oh, I'm sorry,
ahead.
Mr.
You don't have to give
provide
me the answer now. If you have it, could you just provide it to the committee?
Okay, very good. I can give you just a flavor of the profile of these arrears, and again, some of the challenges of.
I guess I'm just curious on if you could provide $2.1 billion.
Yes.
If you can get us the breakout on that, it would be helpful because I know I'm sharing my time with my colleague today, and I know there's some folks that are definitely interested in some of your other answers. So, the enforcement piece is something we've definitely got to go back to. I wonder if you can explain, your work with other ministries, especially perhaps the Ministry of Health. I believe you're working with now. How is that going, I suppose? Is it bearing, they talk about Ministry of Health as well as MPAC being, fruitful in the enforcement piece. How is that going?
The Ministry of Health, you are likely referring to the Auditor General's report and his recommendation at the time to work with the Ministry of Health to expand FRO's ability to utilize the health card database for trace and locate purposes. At the time in 2010, we had very, very limited access to that database. It was a very limited number of inquiries that we could do. Since that time, we have worked very collaboratively with the Ministry of Health and established real-time access to that database.
You have unlimited access now.
Unlimited access, and in fact, in July of this year, the access originally was unlimited, but restricted to our specialized trace and locate unit, and there were, I think, 8 or 9 individuals who had access. 7, that's right. In July of this year, we actually expanded access to all of our enforcement officers, so they now have.
And are they're frequently using that to their disposal?
I certainly hope they are.
I agree.
We're going to be monitoring. We have actually a requirement with the Ministry of Health to monitor how that database is being used. So for their purposes is to ensure that the database is being used with integrity. For our purposes, it will allow us to see how much it's being used and what its effectiveness is. And it is our officers, our staff have found it's much more effective than other databases, simply because patients, when they do come into doctors' offices, they do provide that information.
So the other piece I hear about a lot in our offices is that when there's a garnishment of wages by employers, that they can be extremely slow in forwarding the payments to FRO on behalf of the payer, really despite court orders directing those monthly payments. I'm just wondering, what relationship do you have with employers, or what mechanisms are there that we can get those employers to forward the payments faster? Why does it take so long, I guess, is my question.
First of all, our legislation, and this is the case across all the jurisdictions that I'm aware of, does not require, nor should it require, an income source, an employer to deduct support from an employee's pay before the support is actually due. So when the support, the accrual occurs at the beginning of the month, the actual support amount is garnished from the pays that occur after that obligation per the court order occurs. And depending on the pay schedules of different employers, some of them remit us on a biweekly basis. We do give them the discretion to remit within 30 days, simply because it's a recognition that pay schedules are different. Their scale is different. Small employers, because of the accounting that's required, might have more difficulty to do so more frequently than on a once-a-month basis. The legislation does provide that latitude, but after 30 days, within 30 days, they must remit the amounts that are ordered through our support deduction notices.
And are there those out there that delay post the 30? I mean,
some do. We contact them immediately when they do, and if they persist in either not remitting, and it could be for one payer or it could be for multiple payers, remitting the full amount or not remitting at all, we have the authority to take them to court, to order them, to have a judge order them to comply with the support deduction notices.
How often has that happened, perhaps, in the past?
It happens very infrequently because we do contact income sources, and we do convince them, short of actually taking them to court, to comply. In many cases, it is through lack of knowledge. We do a lot of outreach. We provide a lot of information when we send what we call support deduction notices to employers and what their requirements are. But it is an issue of education, oftentimes as much as reticence on their part.
So when ODSP recipients who also have an active FRO case, their support payments would be sent by FRO to ODSP to be distributed. Why is that even necessary? Why does that even happen?
Minister, when a recipient is on social assistance and they are not well, first of all, if they are receiving support payments on a regular basis, then whether they're eligible or not for social assistance will depend on whether they're eligible, because child support is included as income for purposes of determining eligibility. When those support payments become either infrequent or do not occur, and a recipient is compelled to go on social assistance as a result of that, social assistance payments are made, but during the period in which they are on, for the period in which they are on social assistance, should we collect funds from the payer, those amounts are remitted to the social assistance delivery agent to offset the cost of either ODSP or OW provided to that recipient. And when payments do start again and the individual is not required to be on social assistance, then those payments obviously go to the recipient.
So go ahead.
Yeah, so we do have a requirement to offset, as I said, the cost of social assistance and to recover those funds from the payer rather than flowing them to the recipient. We do, as a matter of course, however, deal with those arrears at the end of a case rather than at the beginning. We do not cut someone off, a recipient off, because we're collecting from.
So so I guess here, if a child support recipient leaves ODSP, the office is responsible for informing the Family Responsibility Office to stop forwarding payments. Now, the Ombudsman did find this year that ODSP was unknowingly holding almost $1 million representing at least 350 assignment cases that were no longer active. I guess, obviously the mandate on, ensuring that we're helping our most desperate citizens, not really strip them away of the resources that they're entitled to. So, how could the ODSP not realize it was accumulating such assets, and what are you doing to fix this problem?
Okay, I can answer part of the question, and then Richard, as the Assistant Deputy Minister responsible for social assistance operations, can add some more. The Family Responsibility Office triggers either the flow of funds to social assistance delivery agents, or ends that flow and has the flow go to the recipient on the basis of the office itself, the social assistance office, indicating whether the individual is no longer on social assistance. And when those terminations do not occur on a timely basis, then we continue to flow funds to the delivery agent, but because there's no social assistance being paid, those funds are held. And as it transpired, there were, as you noted, significant funds held which should have been released when the individual was no longer collecting social assistance. It shouldn't. The connection of information between FRO and ODSP offices and OW offices is highly manual at this point, and as Richard alluded previously, we need to get better at streamlining that process and ensuring that those assignments are canceled on a timely basis. And we are working through business processes at this point, and I'll point to Richard.
Working better with other ministries, especially the one in particular. So
yeah.
I'll cut it off there because I know my colleagues, got 9 minutes.
I'm sorry.
Great. So I'm going to ask for a couple of things that I don't need a response to, but if you could provide them in writing, it would be wonderful. So one would be the survey of the measurement against other jurisdictions. Canada and the North America would be helpful. The arrears per case, the average cost per case, those type of things would be very helpful to do that. Your Good Parents Pay website. So my understanding is that about $470,000 has been collected from 62 parents over 7 years. So what I'd like to understand is what kind of cost you're putting into maintaining and administering that website versus the return. So what type of dollars are we getting back on an annual basis? What's it costing to run that website on an annual basis? So we can really see whether there's value for money. Certainly it's a nice option to have for people to be able to voluntarily, but I think the reality when you're looking at $2.1 billion in arrears, we're not getting there too fast from that perspective. Mm-hmm. I think there's some information that we can try to find in regard to the whole FRO caseload. So, I'm reading that on average you're about 1,377 versus 300 to 450 in the other couple of large provinces. I'm understanding that the caseload actually went from 180,000 to 190,000. So at some point I'd like to understand, what's the plan to get that number down? You can't necessarily control how many are there, but the workload, it seems to me pretty untenable for anyone to have 1,377 cases and realistically expect that they're going to drop that down to a fairly significant number. We've talked a lot about a couple of different areas, and I want to move a little bit into the whole area of adults living with aging parents. It's something that I certainly experience in my riding. I've got some personal situations where I've known families, and they're at that point where mom's turning 92, 93. The child that they've been able to support at home is 60 or 65 years old, but somewhere down the road that's not going to happen. So, I certainly have concerns that I've heard a number of times in the presentation and reading the materials that there's $810 million that are going in there. In March, the Deputy Ombudsman stated there's too much bureaucracy, not enough service. They feel like they're facing endless wait lists, back to what I was just talking about. So I'd like to have a breakdown of where that $810 million is going and what exact specific areas it's being directed to, not necessarily again today in an answer, but if you could provide that to me in writing so that I understand where those are going, where you've allocated those estimates, so I can go back to my people and have that discussion.
I think we could probably do that right now.
That's okay. I don't really need that because, Minister, I think we'll get limited on the questions, and I have very limited time with all of the things that need to be covered. So I appreciate it, but I think as long as I can get that, it also gives me time to digest it and really understand
We'll
it.
make a note.
Yeah. The other is I think what I'd like to really understand on behalf of my colleagues, is certainly in our caucus, I trust maybe the third party, and maybe even members of the government would like to know, is how many people are currently being served in the aging, children living with age, or adults living with aging parents? What are the wait lists? So how many people are currently getting service from your ministry? How many people are on wait lists for it? I'd like those broken down by actually riding if we could, because it would be really helpful for us to understand and know where people are at, what type of planning we can do in regard. And if you don't have those numbers, then it's something I think we need to be looking at. Because if you're planning and you're doing budgeting and you're not looking at it on a geographic area, how do I then best serve the people of my area, or at least answer them on your behalf?
They're definitely collected by geographic area, but through the Developmental Service Ontario office.
Well, that's at least a start. If we can at
Yeah.
least get that by geographic area, then we may ask you at some point to do that further, because, again, I think it's important, and that's the type of things that I'm being asked by my local media and certainly the people of what type of resources are coming in here versus other areas across the province. You know, one of the things we hear in government a lot is equitable, and that's certainly a laudable goal to try to achieve, but I'm not certain equitable necessarily means identical, same for same, and that's what people sometimes get misconfused, misrepresented, and I think it's good for us to be able to do some of those type of things. So, you know, these wait lists continue to be a burden. Minister, I can only imagine that, you know, it's one of those things that you have a concern. I'm going to quote you from, you know, at some point you said these wait lists cannot be eliminated within 12 months, although I believe the committee said that that's what should happen and could happen. I'm not asking you again to regurgitate that or refute that, but I think it needs to be put on the record again that that is the biggest thing that I certainly hear from my riding, and my colleagues across our caucus are certainly telling me that, again, that family member who truly is getting to the point where I can't do this anymore. I cannot put the services and the program, the self-service at home. What's going to happen with my daughter or my son? What am I going to do? Where are they going to end up? You know, we hear horror stories in some cases that actually police are coming in and handcuffing that adult and taking them away to a hospital, because that's their only recourse. There is nowhere else for them to go. They're sitting in certain facilities that are not designed for that person who's 40 years old and has some challenges. They're being put in an old age home because that's the only thing there. I know you well enough that I know that struggles as much with you as it does with me, and particularly more for the people that are in those situations. But I think what we really want to see, and we truly want to open the door to say, how is that being addressed? If it's not able to be done in a year, then I think what the people of Ontario need to hear is I have a very credible plan and I have a goal. And it's a defined goal of a time period. We may challenge you on what that time period is. The people certainly, I think, in these circumstances may challenge you if it's beyond the year, because someone at least has put that thought in their head. But I think what we need to be is credible and say we have an absolute plan. We are addressing this. And I think it goes back to you know, a lot of the ways we look at how we're doing government. Can today's current programs and services, the way they're being delivered, truly meet those goals? And if they're not, then I think we want to hear the answer from you as the minister of what are you truly prepared to do to change that approach to some of those type of situations that we're experiencing.
I do want to reassure you that everyone on a wait list has been prioritized in terms of urgency. We do have a plan. The Assistant Deputy Minister has been working diligently since she joined our team to ensure the kind of consistency that you're concerned about. But we do need to build some capacity into the system in order to get rid of those wait lists. And it's my goal that we move as fast as we possibly can. We are a little bit ahead of schedule at this point, which is good news in terms of what we've been able to achieve, especially with the direct funding for passport and special services at home. But we can give you a little bit more of a fulsome answer, obviously, as you've requested.
And I'd like to visit, if I could, for a second. I really briefly this morning, your former Minister of Finance, Dwight Duncan, he questioned, why are we in the business of collections? Why are we doing this? And I, again, would like a breakdown of the cost within your overall budget to do that collection piece. What truly is the cost of going out and trying to do that collection within your service? And then let's truly let's open it up and let's forget the partisan stuff and say, is there truly a better way to do this? So that, again, maybe some of those resources within that ministry can be utilized actually at the front line of care. Because one of the concerns certainly that I hear continuously in almost, whether it's the Ottawa Citizen Report that I'm reading or a lot of the media that are investigating, are saying there's a lot of things happening. The assistant or the deputy ombudsman, again, referenced way too much administration, way too much bureaucracy. People need to see that front line. That's certainly how I come to work every day. Thank you very much, Chair. Ensuring that those frontline services are the absolute first priority that we're doing. And those wait lists, the arrears, and I get that it's an accumulated, but again, why are we allowing those arrears to build? We need to find changes in the process. We need to think lean and say, what are the wastes in there that we're spending time regurgitating and moving paper as opposed to truly getting there. So those types of things, I think, then show certainly that we're all looking at the same focal points. We're looking at truly those measurements and the outcomes. And I think it's just a review of, are we really measuring the outcomes that are actually going to truly serve the people at the front line, those people that truly need the programs and services across our community services. That's really, in my 3 years, that I'm seeing at the very forefront of people coming through my door saying, I can't get my son and daughter. I'm coming to the end of my tenure, my lifeline, and I'm really, really, really concerned about where my daughter's going to end up. When they hear 23,000 people on a wait list, and they may all already say maybe a year's not where I have my expectation, but they may only have 4 or 5 years, and they don't want to go to their grave, to be very frank, knowing that there's nowhere for my daughter to go. That's something that I think we all have to show, that care and compassion, and it's helpful in an estimates committee like this to see truly where the numbers are going. Is it going to administration, or is it really the focus on the frontline care?
Well, the questions that you've just posed are exactly what I raised at the briefings that I've had over the last several months, and the answers that I have heard from the team at the Ministry have certainly reassured me that we are going in the right direction. But thank you for that, Mr. Walker.
Michael, do you have any?
You got maybe 30 seconds.
30 seconds? I guess then I'll just put in record, one of your colleagues, with regard back to the SSMP new program, I think he referenced a 1% challenge in regard to error, I guess, if you will, and that's going to result in 6,000 people, some of our most vulnerable, our most needy, not getting their check. So in a quick line, it sounds very small and insignificant, but to those 6,000 people, that will be perhaps extremely detrimental to them, and I'm hopeful. I mean, I'm not suggesting anybody isn't there doing their best effort, but again, our job here, we're going to hear that at the front lines. We're going to hear our phones are going to come off the wall.
Thank you. I'm sorry. It's sorry. It is. We will now move on to the third party and Ms. Forrester for her 20
so
minutes.
much. So, Minister, you can see that there's lots of interest in your ministry, lots of questions, and so I'm going to kind of do the same as I did earlier today and ask a bunch of questions, and hopefully we'll get some either written answers or some answers tomorrow. So I'm going to start in the SAMS area. So what is the total cost of the social assistance management system, including the training costs and the 18-month delay and the cost of compensating municipalities? Why are you going to claw back even more from people through the overpayment repayment deductions? And you and I talked about this last week, by deducting the overpayment 5%, not just from the basic rates, but from the additional allowances as well. So, there are people receiving special diet allowances and northern allowances, and my understanding is that you're actually going to be deducting some of that as well. That really doesn't seem to be a very good idea in lieu of the fact that, it's about some healthy supports for people. Have you had any conversations with officials in Minnesota and Maryland about the problems they encountered with this same system? I think it's called CURAM, and they've had a lot of criticism about the flaws in the software. And if you've had those discussions, have you taken any steps or made any expenditures or had any correspondence kind of back and forth with respect to that? And if so, could you provide us with that information? And what are the biggest risks that you see with implementing this system, which is, I think, going to begin this Thursday? Is it this Thursday or next Thursday?
November 11th.
Oh, November the 11th. Okay.
Remembrance Day.
And then just finally today, there was a recent statement from Smokey Thomas, the president of OPSU, regarding the SAM system that was on our email earlier today, that some of the caseworkers, and the union certainly believes that the caseworkers will be spending less time with clients, not more, that the training...
Ms. Forster, we're hardly having a chance to write this down. I know that there are people here who could provide some insight.
Yes.
Well,
let me just finish with the SAMS piece, and then maybe you can...
I think so, because we've had just to sort of wrap some of that up, that would be very useful, I think.
Yeah, so the training has not been adequate, and that in the data system, and I know we have the data system fellow here, that just to add a dependent child to a client's file actually takes 73 separate entries. So those are my questions around SAMs, and look forward to the answers.
Continuity, and for everyone's little grey cells, it might be useful to just have the responses related to SAM, certainly at this point.
Great.
Yes, and Martin, are you
The
able to
total
respond?
cost, were you able to catch some of this?
Yeah, so the
Martin?
total cost is 240.
So they pick it up. Just say your name, please.
Martin Toom, so
Thank
I'm
you.
the executive lead for the project.
Thanks.
So the total cost of the project is $240 million, and that goes right back to its inception in 2009. That includes the implementation of the online social assistance system that's already been implemented in 2011. So that is all inclusive. That
Training,
includes
everything.
all of the costs, including training. Yes. The question around deduction of
Clawback.
the clawback.
Overpayment.
So what that really relates to is that the SDMT did not actually follow policy correctly, and that it only recovered overpayments from basic needs and shelter, but the policy actually states that overpayments are a 5% deduction against your full budgetary entitlement, and that does include those other benefits that you alluded to, such as the special diet allowance. So we use the opportunity of implementing SAMs to correct that. That doesn't actually reduce an entitlement. It increases the rate at which an overpayment is recovered, so that also means that a client will pay back that overpayment sooner, but on a net period over a period of time that isn't going to impact them. It's just the recovery is quicker. Now, you know the amount of money that, like, say, if someone had a special diet, for instance, and that was $250 a month, that would mean that the overpayment recovery would be 5% of that $250 more every month.
So if they didn't have an overpayment in food allowance, it's not going to be clawed back?
No, absolutely
from
not.
those
That's
special-
only for
It's only
clients
clawed
that
back.
have an existing overpayment.
Okay.
So it's the recovery rate. That's what we're talking about there. In terms of Minnesota and Maryland, we watch all CURM applications very closely. I'm actually the chair of the North American user reference group for CURM users, and I talk with other leads on CURM projects quite regularly. Both of those, Minnesota in particular, they were implementing the Affordable Health Care Act, and they were up against some very tight time frames. And what happened was they didn't do the testing that they needed to do before they implemented, particularly around the client portal and the performance. We were actually quite just blown away by how much they cut that out, the testing, and it was largely driven by the time frames that they were required to meet on the Affordable Health Care Act. But we did spend a lot of time with both of those jurisdictions, and we did, take lessons learned, and actually we did beef up some of our performance testing. We are implementing this in 250 offices around the province, and what that, like, we can manage our central system fairly closely, but they also have local infrastructure that we rely on, so we've actually tested with much of that local infrastructure as well, and some of that was lessons learned from those other jurisdictions. In terms of the biggest risks, client entitlement and client service is what is job one, and that's what we spent the most time on in terms of testing and risk mitigation. I talked about earlier looking at the parallel pay run and ensuring that all of, really extensive testing on that. I will say, when I said that less than 1% of those, there's still deviations in the parallel pay run, it's actually 1,900 payments, and there is a very careful, I suppose, the member that asked that question isn't here right now, but there is a very careful process with the field where they, there's many caseworkers across the province. It's actually a very low number, maybe an average of 2 cases per worker or less, where they actually have to go in and look at those cases, but we've highlighted which ones they are, and they have time to do that. In terms of the letter from Smokey, so obviously we've read that, we take that very seriously, and I will say, that comes down to a lot about that spectrum that I talked about, where amongst our our end users, the caseworkers, there is a wide variance in terms of how comfortable they are. And that's always going to be the case with a large change management like this. And we're doing everything that we can to support those that are struggling, and I think that that's always going to be the case. In terms of that was an interesting comment about the 73 separate steps that it took to issue that one benefit. We actually did do a very detailed evaluation of how many clicks and steps all the processes take in SDMT and SAMS, and when you include the notes that I talked about, the fact that there's so much note-taking in the legacy, it actually does end up being less work and less time spent overall on similar activities between the two applications.
It's interesting because I actually worked in an agency that moved to a data collection system, and about 25% of the workforce, because of all the entries, ended up with carpal tunnel and lots of compensation cases. So you need to be kind of cognizant of that, that piece. And I'm going to actually turn it over now to share my time, because Ms. Sattler has some questions for you.
I did just want to reassure you on the overpayment issue, Ms. Forster, because I've been assured that should there be some financial hardship with the new regimen in terms of the overpayment retrieval, that discretion can be used. We're going to look at it if there's hardship on an individual basis.
Great.
Thank you. I had a question specific to the new consolidated employment benefit. And the question is, will this ministry, your ministry, continue to administer the new consolidated employment benefit, or is that responsibility going to be transferred to Employment Ontario and the Ministry of Training Colleges and Universities?
My understanding is that we will continue to administer it. I have my officials here. I think perhaps the deputy, can you elaborate a little bit?
Actually, I'll ask Erin Hanna, our acting ADM, to elaborate.
Hi, thank you for the question. The Minister is absolutely correct. The Ministry of Community and Social Services, through both our Ontario Works program and the Ontario Disability Support program, will continue to administer the new employment benefit within each of the respective programs for people with disabilities and people without disabilities.
Okay, that's great. And then the next two questions I'd like to request a written response to, because they require a bit more detail. So the first one is around the role of municipalities and local service managers. We know, obviously, that they have significant expertise and local knowledge to contribute to the implementation of the new consolidated employment benefit. So we'd like to know what consultation, if any, has occurred with municipal service managers, and if the committee can be provided with an overview of the concerns that were raised by the municipal service managers. So that's the first request for a written response. And the next issue is around funding. So in 2010, the government announced a change to funding for the cost of administration for Ontario Works, and at the time, your ministry committed to releasing monthly caseload statistics to municipalities and DSABs so that they could plan and budget for the work of administration within multi-year budgeting cycles. We have been told that this information is not in fact being made available on an annual or monthly basis as promised, so it creates difficulties for DSABs and municipalities, obviously, in their budgeting process. We would like to know, why is that information not being made available to municipalities, and we would also request that you table with the committee the monthly OW caseload statistics for all CMSMs and DSABs for the past 12 months, as well as caseload projections for every CMSM and DSAB.
Okay, just a point of clarification in terms of, first of all, your first point related to the role of municipalities and local service providers. This relates specifically to the area of their role in employment service provision. Is this what you're getting at?
Yes, and their delivery of the new consolidated employment benefit.
okay. In terms of actually working with clients related to employment opportunities, are you talking about there was some thought to consolidate all employment services within amalgamating smaller agencies and under one Employment Ontario office? This is not what you're getting at.
No, it's about the role of the CMSMs and the DSABs
in the employment benefit.
Yeah. And so we're interested in knowing what kind of consultation occurred and what were some of the issues that were brought to you during that consultation process.
We do have officials here. We can probably answer that very quickly.
Well, I think we have a number of issues to address. If that could be addressed very quickly, that would be good. But if
consultation.
Hi. Yes. So we started in. I'm sorry, Erin Hanna, ADM Social Policy. We started engaging with municipalities on the employment-related benefit actually prior to it being announced in the budget. So we had conversations conceptually about that direction. Since then, we've continued to meet with our municipal partners both through a technical working group as well as a senior-level provincial municipal working group. And we've been sharing most recently information about how we might approach the allocation of the funding, because this will change how we provide the envelopes to support the delivery of the integrated benefit, and testing out options and getting their feedback on that. I understand you want a quick answer, so I won't go into all of the feedback that we've heard, but I'll say very briefly that clearly there's concern about ensuring that we provide the appropriate transition period, ensuring that we tie the funding to the size of caseloads, ensuring that we allow for flexibility in the funding model, and working with them on an ongoing basis to evaluate the effectiveness of the new approach on employment benefits.
And on the second point, I just want to make sure that the deputy understands exactly what you're getting at, so we can provide. Again, Erin, are you clear?
I'm clear. Yeah.
Okay.
Okay.
We can get that too.
Those were my questions. Thank you very much.
You still have 5 minutes.
Okay, so on to ODSP medical reviews. So, we know that they're necessary, but we believe that kind of the current system is flawed. They can be exceptionally difficult for ODSP recipients because they have to fill out that second package. It's intensive. It can take a long period of time. And this year your ministry is going to do an unprecedented 600 medical reviews per month. And, that in itself certainly creates work for our constituency offices. And is going to create a lot of work within your own ministry as well. So the Commission for Review of Social Assistance found that the application process for ODSP that requires applicants to provide detailed medical assessments to provide the severity of their disability and may take months to conclude. What is the current number of cases in the ODSP medical review backlog, and how does that compare to last year? I'm going to ask a number of questions. Can you provide the committee with the rate at which medical review recipients are no longer eligible for disability supports for last year and this year, and the rate at which those medical review decisions are overturned upon appeal? Is it every case that has a potential for review in the scheme of things? And what is kind of the final target per month for backlog and new cases? What percentage of applicants or recipients are required to have a specialist assessment, and how is the ministry facilitating that process to actually get people to specialists in light of the fact that many of them come from communities that are sorely kind of underserviced with specialists? And in other jurisdictions, there's been concerns about suicides amongst disability benefit recipients who are subject to a medical review and found no longer to qualify. So does the ministry collect any data on the number of suicides amongst persons who are forced to submit to an ODSP medical review kind of a second time after they've been approved initially? And if so, can you provide us with some documentation around that data?
Okay, I'll turn it over to Erin Hanna, but I do want to say, Ms. Forster, that when I heard about the medical review, I asked to look at the package and go through it, and I understand your concerns about it. Obviously, eligibility it's very important to be assessed. We do have the need to be fiscally responsible. We need to ensure eligibility, and we need to ensure consistency. So that form, as you know, is being used consistently. But I'll turn it over in the last minute or so to Erin.
Thank you. Erin Hanna. The medical review process, just to start out as a reminder, and the Minister touched on this, is that it's really focused on individuals whose condition might improve. So our goal isn't to try to reassess individuals for eligibility for disability support if there's really no hope that their condition is ever going to change or improve. So I just wanted to put that in that context. So you asked a number of questions, and I'll very quickly go through them. In terms of the backlog, we currently have about 63,000 cases in the backlog, and what the backlog actually represents is all of the cases that have a medical review date that has passed. So that's the simple definition of the backlog. In terms of results on how many people were found not to qualify for disability support anymore, and how many of those decisions were then appealed to the Social Benefits Tribunal and resulted in an overturn, we have limited amounts of data at this point in time. We actually only restarted medical reviews in February of 2013, and because the process itself allows for the client to have time to collect the information, have the package completed with their healthcare professional. Once the package is submitted, there's a period of time to review it. There's also an opportunity after a decision has been made for the client then to go through an internal review and then the appeal process. And we don't cut people off during that period. So it takes some time for us to get outcome data, I guess is what I would state.
Thank you, Ms. Hanna. Sorry. We will now move on to the government, where you will have 20 minutes. Thank you, Ms. Wong.
Thank you. So I'm going to start the first round of questioning. Minister, thank you so much for being here today. And I want to follow up with your opening remarks this morning. And I'm going to quote you. You said in your opening remarks that your ministry is building a fair, healthier province because of support we offer to vulnerable Ontarians to make them full and active participants in our communities and in our lives. So in terms of your ministry, can you share with the committees in terms of the targeted investment to address those who are most vulnerable and to those who are lowest incomes to make sure they're receiving the benefits to ensure that these benefits are targeted to ensure these vulnerable Ontarians getting the needs they deserve?
Well, thank you, Ms. Wong. As I think most people know, Ms. Wong and I worked for many years together at the Health Department in York Region, and I know that looking after the vulnerable was something that we in public health were always extremely concerned about. We believe that the determinants of health certainly include income security, social inclusion, opportunities for education. These are all extremely important measures to keep our population healthy, and many of those determinants of health are relatively easy for the majority of our population. For those who perhaps have a disability, whether developmental or acquired, or those who lose their job, they need help. And that's why, that's really the whole purpose of this particular ministry. And it's important that we do this. It's also very important that when we have everyone achieving their full potential in our society, they're able to contribute. If someone has income security, they're able to go out and purchase goods and services and be part of society. So helping individuals who are struggling in terms of putting a roof over their head and having sufficient food to eat, it's extremely important work. And that's why we believe in this ministry that we need to continue to invest in the people of Ontario so that everyone can reach their full potential. But we do not want to lose sight of the opportunities for employment. And I've been saying to my ministry officials, to me, this is almost the next frontier that we have to challenge, because in terms of those, especially those with disabilities, those with mental health issues, gaining competitive employment is often extremely challenging. And we're working with employers. We're doing everything we can to reduce that type of stigma. We do have some champions out there in terms of employers who are actually learning from each other. A champion is an individual with a number of Tim Hortons franchises, Mark Wafer, and he is going to his colleagues in the business community to say, you know, I hired someone with a disability, and you know what? It was great. They were so anxious to come to work. They felt they were contributing. Sure, you may need to tailor the workplace a little bit and the opportunities to the individual, but it is rewarding work. So that type of inclusion is incredibly important. I've visited a number of places where individuals with disabilities are employed, and the sense of accomplishment in those individuals is really palpable. So supporting the most vulnerable, providing what we do in terms of social assistance, whether it be Ontario Works, whether it be ODSP, is extremely important. Our government, as you know, is committed to poverty reduction. The minister responsible is going to be establishing new goals to ensure that there's no more homelessness specifically, and that we take every measure we possibly can in terms of reducing poverty. And our ministry, as I've said several times through the course of the day, we are absolutely committed to that work, doing it in the most efficient, streamlined. You've heard about some of the modernization efforts, the computerization and so on, doing everything as efficiently as possible, but ensuring that our most vulnerable do receive the types of supports that they need.
Okay, I think you're going to ask next question.
Thank you, Minister, for your previous reply. And as you are aware, there is a lot of evidence suggesting that developmental services system and the people it is intended to serve have been in need of attention and investment. And this was certainly something that I became acutely aware of in my work in the federal office. We shared the same building with the provincial office, and we very frequently saw cases that were extreme and worked on cases that were extremely challenging. One of the things that did become very highlighted during that period of time was families that would come in and they would have children with disabilities that couldn't even manage a simple office visit. And you can imagine how, and I know you know this, how challenging it is for those families to even just go to the store and buy milk or eggs. So I'm certainly very appreciative of how much we have invested and our focus on families with who are dealing with disabilities. So the 2014 budget is quite significant in terms of investment for the developmental sector and must surely have been welcome news. And in fact, during the election period, many people approached me and said how glad they were that we were making this investment. And as many of us heard during the election period, we were spoken about by leaders in the union movement who said that it was the most progressive and socially justice-minded budget for many decades, so that I was very, very pleased to see that. I'm wondering if so it is an area and a population that the government has recognized that's in need of transformation. Obviously, many of us are very happy about that. But can you tell me what is the government doing to reform and improve the quality of support for developmental services?
Well, thank you very much for that question, and it does relate to what Mr. Walker asked earlier, because, of course, this $810 million over the next 3 years is one of the largest infusions ever into this sector, and we really hope that it will take us to that next step in terms of transforming developmental services in Ontario. And before I detail some of what we are going to particularly do with that $810 million, I do want to say, though, that we have transformed the system over the last decade. I think it's worth noting that since our government took office, that we have made dramatic changes in this sector, particularly the last 2 years, but there was ongoing incremental improvement through the years, so that even if you just look at the budget, some 10 years ago, about $1 billion was spent annually on developmental services in Ontario. Now we have some $1.7 billion spent annually on developmental services, and we have committed with this new investment of funds that that budget will grow to $2 billion in 2016-17. I think the greatest change is the move from large-scale institutions for adults with developmental disabilities, moving into inclusion in the community and having residential supports for individuals now out in the community. There have been references to elderly parents looking after adult children, and certainly a lot of the funding that we intend to invest in the sector is going to go towards housing those individuals who are now perhaps in their 50s or 60s being looked after by elderly parents. Those situations are clearly urgent, and we will be able to offer a variety of opportunities in the community, and those can vary from simply living independently in an apartment unit with support coming in on a daily basis or checking in from time to time, through to group homes, through to pretty intensive residential support as well, with the involvement of Ministry of Health, CCAC, and so on. We have a very diverse population in this sector, and we know that each has a unique need. We have a program that I'm really quite excited about. It's a host family program. We have some 500 families in Ontario taking in individuals with developmental disabilities to care for them in their home, which makes them part of a family, and they are supported, obviously, in that endeavor. We have a housing task force that's going to look at more opportunities for inclusion, perhaps look at some of the models that have proved to be the most successful out there, and also to help us manage the wait list for residential accommodation. This investment, even this year, we're very pleased. We have some 350 individuals who are in process of transitioning into a residential option suitable to their needs. And obviously, again, dealing with this population, moving to a new home may take some time. So it requires visits, acclimatization, and so on. But I'm very pleased to have heard that we're working on that first 350 individuals, because this investment of the $810 million will, in fact, house some 1,400 people who are on wait list. So I think that's incredibly positive. I mentioned in my opening remarks about opportunities for direct funding through Passport in particular, and we're making real progress with that. This is the program that does provide additional choice to individuals, so that they can choose whether they want to join a municipal recreation program. They have the choice as to what suits their individual needs. And so again, since our budget was passed in July, we have provided an additional 1,900 individuals with passport funding, which is again a little bit ahead of schedule, and we're going to keep pushing to ensure we try and get rid of the wait lists as soon as we can. We do believe that we have much better coordinated assessment in terms of eligibility and opportunities for discovering what's available in a community. So this is why we did establish the Developmental Service Ontario, 11 offices in 2011. And of course, they are providing consistency, a common application form, and some fairness to the system. And they are working with their community partners to ensure that a variety of services are provided in the community. So in essence, what we're doing with this investment is taking our developmental services to the next step. We've talked a little bit about the employment opportunities, and I'm really excited about that particular aspect as well. We do have a specific, it has been mentioned, the Employment and Modernization Fund that will literally tailor work opportunities for an individual. I was actually in Kitchener at a wonderful institution, Lutherwood, and the caseworker there was literally assessing individuals with disabilities one by one, finding out what their goals were, seeing if they needed some additional training, what they needed to get into the competitive workforce. And in Kitchener, they're way ahead of their targets. It was excellent. And I think that kind of local input is very, very important, because this individual knew about the employment opportunities locally, was able to talk to employers, get them to check with people who had employed people with disabilities, so that they were reassured that this could work for them. So it's very exciting news, I think, for the sector. I've met with many community living organizations across the province, and they are really, as I understand it, very pleased with this infusion of investment into their sector.
That's excellent. Thank you very much.
Thank you.
Mr. Balkinson?
Do we have time?
Yes, you do.
Okay. Thank you. Thank you, Madam Chair. Minister, it's a pleasure to see you here. And as you know, I had the privilege of serving on the Select Committee on Development Services with my colleague at the far end, Ms. Wong, and we traveled the province from, I guess, city to city. And almost at every city that we went to, we heard from the public they had concerns with eliminating the wait lists for those children and adults who meet the requirements for support and wasn't receiving it. I'm wondering if you could tell us what has happened since that committee report and where the ministry is going and what we can expect in the next little while.
Well, clearly the government has responded to the Select Committee's report on developmental services, all 46 recommendations, and I can say unreservedly that certainly the spirit of those recommendations is exactly what the officials in my ministry are working very hard to ensure are implemented. In terms specifically of wait lists and some of the commitments that we've made with the additional funding, I can give you a number of figures. Certainly we will be providing direct funding for approximately 21,000 people. One of the areas, again, that the Select Committee was particularly interested in, and Ms. Jones did mention it last week after my ministerial statement, was support for transitions from childhood through to adulthood. And specifically, our investment is going to support more than 4,200 people as they do navigate key life transitions, such as going to post-secondary school or getting a job. So our ministry, and actually my parliamentary assistant, through her mandate letter, I believe public today, has been charged with working specifically with the Ministry of Education and the Ministry of Children and Youth Services to ensure that
Minister,
those
2 minutes.
transitions... Oh, I'm so disappointed, Madam Chair. So, in fact, working with school boards, and I understand school boards are already signing on, because we need parents to be really aware that we want to start planning very, very early. We've talked about, for those with a developmental disability, it was alluded to that often the course can be fairly predictable. We probably can start some planning around age 14 and ensure that there is a plan in place for each individual in terms of opportunities for training that helps the individual to reach employment. We want to get as much planning done in advance as possible. And as I mentioned previously, we do intend to provide residential support for an additional 1,400 people. I mentioned the host family opportunities, the supported independent living programs. All of these will be supported through this additional investment. And again, funding for frontline workers, which is a piece that is also very important. I mentioned the dedicated workers that I've met. We've certainly enhanced their training opportunities to be a DSW, but we want to ensure that, in fact, they are compensated additionally, and those negotiations are ongoing as we move forward to implementing some additional $200 million over 3 years for support of frontline workers.
If I could just give a quick comment. You mentioned your parliamentary assistant would be working with the Ministry of Education. I would ask you to also consider the Ministry of Training, Colleges and Universities, because I have had some students coming out of the high school system and they want to get to community college and there's not enough space.
Thank you. Thank you. Okay, so it is now 10 minutes to 6. We are expecting the bells to be ringing at any time for a vote. I'm going to test the room to see if the official opposition would like to start your time or whether you would like to adjourn at this point and start fresh tomorrow.
Now and start, the bell will ring in any time now.
Okay, so we will do that then. Thank you to the ministry, but I have a housekeeping matter. So I believe we have an agreement not to bring the Ministry of Energy in tomorrow for, I believe it would be 10 or possibly only 10 minutes at this point, and to have them return in the Tuesday following constituency week, which would be November the 18th. Are we in agreement?